How long does a facelift last? That is a fantastic question, and it's dependent on a number of factors. Obviously, the younger you are when you have your facelift, the longer it's going to last. The older you are, the more likely you have aged further. Your tissues don't have as much elasticity or snap back in them, and the more likely you'll need other procedures. But in general, the literature shows that most deep plane facelift surgeries last between 10 and 15 years. Most patients will have their surgery between the ages of 45 and 65. Some of us do younger patients and older patients, but in general, that's usually the normal range of time in which somebody's going to have their procedure. And in that case, you're typically fairly healthy. You've probably done a moderate amount of self-care, use of sunblock, etc. But things like your genetics are going to determine longevity. Whether you are a smoker and continue to smoke after surgery, that's definitely going to shorten longevity. And of course, we always have our genetics. And finally, self-care. So the actual outcome of the surgery is 80% the surgeon and 20% is basically up to you, your genetics, your past history, your history afterwards, and how you're going to care for your facelift. So assume 10 to 15 years in most cases before you see enough re-aging that you might want to consider a second facelift.